welcome everyone. Today we have our expertise Dr. Neeraj Goel with us. So, we are going to discuss about an important topic, colorectal cancer. As we all know, this is increasing in our generations and it is most common in the youngster. So, we have our expertise Dr. Neeraj Goel. I would like to welcome him and start my questions with you, sir. So, we would like to know what is a colorectal cancer?
Colorectal cancer is any growth, any cancer which is developing into the large intestine. Large intestine is colon, and the end part of it is rectum. Rectum is where the stool passes out. So, any cancer, any growth which is happening into colon and rectum is a colorectal cancer.
Alright, sir. So, what are the signs and symptoms of the colorectal cancer, sir?
Colorectal cancer, the signs and symptoms are very subtle. The first and the foremost important sign is bleeding per rectum. You might be having bleeding which is mixed with stools, you might be having bleeding which comes after the stools. Usually it is painless. Sometimes it happens that you might be passing black colored stools. So the bleeding which is bright red in color is usually due to rectal tumors. The bleeding which is black in color might be due to your tumors into your large intestine, usually onto the right side. This is first symptom. Second symptom is constipation. You, me, everybody must be having constipation, but recent onset constipation means you are perfectly fine for last 2-3 months. You have started observing constipation. That is a very subtle sign of your cancer, the colorectal cancer. Apart from this, the third one is what we call as obstruction, that you are not able to pass stools or flatus. Sometimes it happens that you are absolutely not able to pass it and your abdomen distends. That is an emergency situation. This is the third symptom. The fourth symptom of it is usually the people say that I'm not able to eat properly, means you are having anorexia and you can have weight loss. The important symptom which I would like to just impress upon is anemia. Because your hemoglobin is low, people usually, I would say even the physician don't take notice of it. This anemia can be a very subtle symptom of your colorectal cancer. So we have to be aware in any adult, if we find anemia, we have to keep in mind that we might be having a colorectal cancer and we have to investigate likewise. So if I just summarize, bleeding per rectum, constipation, obstruction, anemia, anorexia, weight loss. So these are the 6 commonest symptoms of colorectal cancer.
Thank you so much, sir, for explaining the detailed signs and symptoms of colorectal cancer. And the next question that might be patients are curious to know about it. What caused the colorectal cancer?
Colorectal cancer, I would just like to divide the causes into 2 things. One is my lifestyle, which is the most important cause of it. Second is hereditary. So the lifestyle is if I am taking alcohol, if I am doing smoking, if I am having red meat. Red meat means mutton and your pork. So red meat is a risk factor. You'll ask me whether chicken is there or not. The white meat, the risk is slightly lesser, but the red meat is most important risk factor for this colorectal cancer. So smoking, alcohol, and this red meat, and your inactivity. Lack of exercise, obesity, our younger generation has become couch potato. My dietary habits are changing. We are eating lots of processed food. These processed food lead to the development of colorectal cancers. So these are 4 or 5 important lifestyle things which are going to cause colorectal cancer. Apart from this, if a small percentage of the people are into the hereditary colorectal cancer syndrome. For example, Lynch syndrome, people know it about it, is called as hereditary non-polyposis cancer colon. Sometimes it is familial adenomatous polyposis, FAP, and sometimes it is that you don't have any syndrome, but someone in your family has got cancer, so your risk of colorectal cancer automatically increases. And majority of the cases you don't find any cause. The cause is usually your lifestyle. So lifestyle is the most important one. There was one statistics which say if I'm able to control my lifestyle, stop alcohol, stop smoking and all these things, so I'll be able to prevent 50% of the colorectal cancers from developing.
That's so informative explanation, sir. So we would like to move to the next question. It is like what is the diagnosis of colorectal cancer?
The diagnosis of colorectal cancer is made by colonoscopy. That is an endoscopy which is done from the anal opening. You put a large endoscope, you take it inside. Wherever you see a growth, you take a biopsy. That biopsy, when seen under microscope, will confirm the diagnosis of your cancer. So it is diagnosed by that. Once I diagnosed my cancer over there, I have to go on to the further investigation. The further investigation is for staging. You must have heard of stage 1, 2, 3, 4. So these further stagings, I have to get a CT scan, I have to get a PET scan. I usually get a PET scan because it gives me the CT and the PET both. And for rectum, my MRI is also important. So the foremost investigation is colonoscopy and biopsy, then followed by your CT scan or PET scan.
And so, what are the treatment available for this?
Because colon and rectum, the treatment is slightly different. I just take on to the colon, means the large intestine. For colon, the primary treatment is surgery. If I'm able to operate the tumor, I've got the biopsy, I've got CT scan and the PET scan. If they say that the tumor is operable, then I take the patient up for surgery straight away. And I operate upon the tumor, do the right, left, hemicolectomy, whatever the things are. And then, according to the stage of the tumor, the patient is taken up for chemotherapy. So, in colon, we straightway go for the surgery. When I come to the rectum, there are minuscule patients in which we can do the upfront direct surgery. So, in that scenario, we have to assess by MRI, by PET, and then the patient is subjected to what we call as neoadjuvant therapy. Means before surgery, you have to give some treatment. That treatment is usually chemotherapy and radiotherapy. When you finish this chemotherapy and radiotherapy, which usually takes around 4 to 5 months, then after 6 weeks of that, you take the patient up for surgery. So, in that scenario, surgery is done after chemotherapy and radiotherapy, and after your surgery is done, you give the remaining chemotherapy if something is there. So there are certain protocols. Accordingly, we decide whether to give chemotherapy completely before or divide it into parts, some before, some after. So, in nutshell, surgery is the main treatment. If I am not able to do it upfront, means straightway, I have to give chemotherapy and radiotherapy in a case of rectum first and then operate.
And we would like to know your insight. What are the preventions and the change in lifestyle to prevent this type of cancers?
So I started into the causes of it. So alcohol, that needs to be stopped. Smoking, that needs to be stopped. If you are non-vegetarian, I would say shift to white meat and eggs. Don't take red meat. And the most important thing for younger generation, you pointed out that the young people are getting more and more colorectal cancer. I have to be very active, drink at least 3 liters of water in a day, move around 5 kilometers in a day, and please avoid as much as possible the processed foods. Increase your activity. If you can join gym, these are the lifestyle changes. If I am able to do, I will be able to prevent more than 50% of the colorectal cancers.
Alright, sir. And so, what would be the recovery process after the colorectal cancer?
The colorectal cancer surgery is usually done laparoscopically or robotically. Sometimes we have to give incisions. We do it majority of the time robot or laparoscopy. The recovery is faster. Majority of the patients, they get discharged around 3 to 4 days of the surgery. If I talk about the complete duration of the recovery, maybe around 10 days, the patient is absolutely fine the way he was before the surgery. And for the chemotherapy, I would say that duration of the chemotherapy depends on 3 weeks or whatever. That is the period for that complete total treatment. But after surgery, majority of our patients, they get all right within 3 to 4 days, and they are perfectly normal within 10 to 12 days of surgery.
Thank you so much, Dr. Goel, for sharing your insights and experience to us, and spreading the awareness about the colorectal cancer. And thank you so much for your time and letting us the informative information. Thank you so much, sir. Please like, share and subscribe to the channel, and for more information, please connect to the channel, and the next topic will be gallbladder cancer. Thank you so much.